Good afternoon, everyone. Good afternoon, everyone. I am Dr. Vignesh, DNB General Surgery resident. First of all, thank you for giving me opportunity to present my case here. Abdomen is commonly called as Pandora's box or magic box because abdomen never fails us to give us surprises every now and then. This is one such case of cecal perforation due to foreign body mimicking as acute appendicitis. Foreign body induced gastrointestinal perforation is an uncommon clinical condition, but it can mimic more common pathologies such as acute appendicitis. This case highlights the diagnostic challenge where rare pathology mimics a very common clinical condition. Our patient is a 60-year-old hypertensive male who presented to our OPD with complaints of acute abdominal pain and fever for 4 days with a recent history of travel and binge alcohol intake. On examination, patient's vitals were within normal limits. On abdomen examination, there was right iliac fossa tenderness with godding. Based on clinical findings, clinical diagnosis of acute appendicitis was made and patient was further evaluated. On blood investigations, the total counts and CRP were elevated. On radiological investigation on USG, there was an inflammatory mass in the right iliac fossa with minimal fluid collection in the right iliac fossa with minimal thickening of the cecum, inflammatory thickening of the cecum. And CECD abdomen also showed periappendiceal fat standing and minimal fluid collection. Both were suggestive of acute perforated appendicitis. So patient was posted for laparoscopic appendicectomy. This is an intraoperative video where there was a minimal adhesion in the right iliac fossa. Adhesion was cleared and cecum was identified. And while we handling the cecum, we found there was a perforation of the cecum by the foreign body. So we slowly removed the foreign body, which was looking like a fish bone. So we removed the foreign body, which was looking like a fish bone, and we removed the foreign body. It was a sealed perforation. There was no leakage from the cecum. Till the cecal perforation site was repaired using polygalactin 2.0. After that, the appendix was looking normal only. There was no signs of inflammation. Appendix was looking normal only till we did the appendicectomy also. And both the appendix and the foreign body we sent for biopsy, histopathological examination. As you can see in this image that fish bone was around 4 cm in length. So we sent for histopathological examination along with the appendix. So patient post-operative period was uneventful. Patient recovered well without any complication. Polyps was removed on post-operative day 1 and the pelvic drain which was placed removed on post-operative day 2, and patient was discharged without any complication on post-operative day 3. And after 10 days, patient was followed with histopathological report. Incidentally, there was a chronic pancreatitis. There was no acute appendicitis. The features were suggestive of chronic appendicitis, and that foreign body was suggestive of necrotic bony tissue, probably a fish bone. So, learning points from my case are: foreign body induced cecal perforation can clinically and radiologically mimic acute appendicitis. Imaging modalities may not always accurately identify the underlying pathology. So, high index of suspicion and careful intraoperative evaluation are essential for accurate diagnosis and appropriate management. Whatever the sophisticated investigations, technological advancement, or artificial intelligence can support in diagnosis, but it can never replace detailed history taking and thorough clinical examination. So this is an example for this common saying: uncommon presentation of a common disease is more common than a common presentation of an uncommon disease. Thank you.